Okay, good afternoon, Marius. First of all, thank you so much for doing this session. I know that you are very busy. You're going to go to conference, in a few days' time, and thank you so much for making the time for this. So, could you briefly introduce yourself and tell us about your role and your research background?
Sure. Hi, Zheng. Thank you for having me here. I'm a medical sociologist by training, and after having taught in international universities in China for about 8 years and a half, last year I made the decision to go back to Romania, which is my country of origin, to join the faculty in the Department of Sociology at the University of Bucharest. And starting from this fall, I will also be a fellow of the New Europe College in Bucharest, which is an institute of advanced studies. And my biography, as well as my research background, have been quite international. I graduated from the University of Arizona with a degree in sociology in 2009. And I did my PhD at the University of Hong Kong. And as I have said earlier, I have spent 8 years and a half teaching global health in mainland China. So this is briefly my background. I also did the research. I conducted fieldwork in 3 countries, in Romania, China, and Cambodia. And I have supervised the master's theses in different parts of the world, including Cambodia, China, United States, and Switzerland.
So I saw that you have published some very good work, especially access to healthcare in Romania. So so for today's session, I want to ask so what is your research about, and what are the main research questions that you are trying to answer? Yeah.
This is a very good question. So if I were to summarize, I would say that there are 3 lines of research that I have pursued so far. The first one, as you mentioned, is about the social organization of the access to healthcare in different settings, mostly in Romania, but also in other countries. So in 2023, I have published my first book, which is about the moral evaluation of patients. And this research is based on 7 months of ethnographic fieldwork at the emergency department of 2 public hospitals in Romania. I was interested in understanding how people are handled by the triage nurses and clerks, and how the medical staff make decisions on how to prioritize the cases. Who should be admitted immediately and who should wait longer? How are the patients treated while they are in the emergency department? So these kind of questions made me pay attention to the interpersonal level, because when we discuss about access, very often we look at structural barriers. We look at the cultural difficulties that people have to access quality healthcare. But there is also this often neglected interpersonal level in which some people get excluded and other people get included. So this is what I have done. I was looking at these apparently trivial but highly consequential practices through which some patients are prevented from getting timely access to emergency healthcare. And also in this direction of access to healthcare, I conducted a study about how people in Cambodia are managing their symptoms that are typically associated with hypertension and diabetes. And when they have this kind of symptoms, what do they do? And we have discovered that there are some important limitations that are preventing people from getting the quality healthcare that they need. Also in China, I conducted a study about the oldest old and why many of them are bypassing primary healthcare. Why do they go to second or third tier hospitals rather than going to the primary healthcare facilities? The second line of research is about informal practices of access. And when I mention informal practices of access, I have to say that they can be both monetary, for example, the informal payments, the hongbao in China, the envelope payments in Central and Eastern Europe. Well, they can be non-monetary, for example, the connection work, the guanxi. These practices are also related to the access to healthcare, but they are very interesting because they defy easy categorization. They fall somewhere in between the logic of gift and the logic of corruption, One author, Aber Poleze, also proposed the sensitizing concept of briefed to describe informal payments. Briefed meaning that they can be somehow regarded as bribes, but they can also be regarded as gifts. They are neither perfectly bribes nor perfect gifts. They are somewhere in between. And the third line of research is about aging, which is a social process that I became interested quite recently, and I have worked on 3 papers, co-authored papers in China. One of them is about the social engagement of older adults in urban China. The second one is about what I have mentioned earlier about the oldest old who are bypassing primary care. And the third paper, which will appear as a book chapter, hopefully this autumn, is about the values that are informing the health-seeking behavior among the oldest old in China.
I see. So I mean, like, so I feel like the work that you've done, they are very significant, and they are helping, people to understand more about like the, like we said, access to healthcare, about like the aging, in different kind of settings like Cambodia, China, and also in Romania. So when you are doing this kind of research, so what are some of the bigger challenges that you have encountered, in this area?
Yeah, I have decided to study topics that are inherently controversial. And this is a challenge, but also a huge opportunity. But one of the things that I have been worried about for a long time is about the accounts that I am producing, because no matter how objective I want to be, the representation that I produce would somehow distort what is going on. For instance, in the study of the moral evaluation of patients, I show how triage nurses are relying on stereotypes and prejudice to handle the patients, and how the medical settings become a place in which the wider values become reproduced and reinforced. And all these things are central to my interest in the moral evaluation of patients. But a reader who just gets access to what I have written might regard the medical staff as being callous individuals who are not very careful about what they are doing, not caring, not empathic at all. When in fact the things are much more complicated. Many triage nurses are genuinely concerned with the well-being of the patients. When they are acting harshly, they are doing it in part because they had to cope with some structural constraints that they cannot handle otherwise. For example, there is a mismatch between the desire of healthcare and the resources available to satisfy it. And because this has to be done locally, they have to be much more harsh than they would have probably been inclined to be. So these kind of concerns are very important for me, because it would be very difficult to do justice to what is going on in a specific environment. The second challenge that I can think of is the fact that fieldwork, especially in international project, is quite demanding in terms of resources. And this is a problem that many of us are sharing in this field.
I see. I mean, so based on like the research that you have done in different country, different setting. So how do you translate your research finding into practice, policy, or benefits for the communities and the wider public?
Yeah, I think this can also relate to the fact to the previous question, because another thing that I was quite concerned with is what are the implications of the studies that we are producing, because sometimes the findings of the studies are used for developing evidence-based policy making. So I think as researchers, we have a very huge responsibility towards the people that we are working on and towards the well-being of the society in general. To answer your question, I have tried to work with organizations on research that would inform policymaking. And for example, I was commissioned by the WHO Regional Office for Europe in 2013 to write a research report about the health mediation for Roma communities in Romania. It was the first case studies. They have produced several other case studies. And I have seen that it was quite widely cited, including in laws in Romania and not only Romania. Also, other research reports have been used to develop policies or to justify the development of some policies. In general, when I'm doing research, I try to reach out a wider audience. So, for example, earlier this year, I have published a paper about the decline in informal payments for healthcare in Romania. And in addition to the academic publication, I have tried to reach out to the most widely interested audience, the medical community. And I wrote an article in a newsletter or magazine that is called Viața Medicală, Medical Life, and which is widely read by the medical community in Romania. And I've got quite a few responses from people, so I think it stirred up some debates. Also, I try to engage with the wider public by writing materials in online publications on online platforms. And I always respond positively to the invitation from the journalists to talk about the issues that I'm interested in.
I see. Yeah, I mean, like, so because you have done a lot of like studies now, especially in terms of the sociology. So how do you think the AI is going to change the way that research is being conducted in this field over the next 5 to 10 years? Because now, because the AI is going to change everything, right? So how does that going to change, like, let's say, sociology, in this case?
Yeah, it will be very difficult to anticipate what's going to happen because obviously AI is calling into question the way we have been doing things for many, many years. I have to say from the very beginning that I have a generally positive attitude towards the AI, and this might be related to my own background because when I was studying in the United States, I became highly frustrated with the fact that I got points deducted for most of my assignments for the quality of the language, the grammar, vocabulary, these kind of things, which I have, not been very happy with because I felt like being punished for not being a native speaker. And later on, when I was publishing, I had all comments about lack of clarity in the language, words choices that were not the most fortunate, and these kind of things. So I think that at least in terms of editing the materials, this can level the playing field. This can give a better chance for people who may not have the best level of English to publish their findings in important journals. So it removes one of the invisible barriers, but highly important barriers in publication. Also, I think that AI can act as a very good research assistant. It can do lots of things that are time-consuming and not always highly rewarding. For example, transcribing interviews, and sometimes even coding some materials, even though I have mixed feelings about it. I don't think that AI would become capable of doing very sophisticated reflexive work. So I think it could be very good to be mobilized when people are doing thematic analysis, for instance. But for a grounded theory, it would be almost impossible to think that it would be as developed as to do this. So for the kind of research that I am conducting, I don't feel that AI is helping too much, but definitely it would bring some benefits. It will also bring challenges for sure. One of them is about the proliferation of articles that may not be of the highest quality, that look very convincing at first glance, but might not be very substantial or very well integrated into the literature. So I think the role of the peer review will become more and more important in the years to come.
I see. Yeah. I mean, like, so how about in terms of teaching and learning? Just a quick follow-up question. I mean, like, how, especially if you have been teaching in China, and also you are doing research, let's say maybe, in Cambodia as well, and also there's a lot of international students maybe, in your institution as well. So how do you think that, for example, like the use of AI And especially in your teaching and learning practice, how is that going to affect you, especially when you are dealing with, let's say, maybe students from China, when you're teaching in China, right? So do you think that, that's going to change like the way that you teach? Yeah.
I think all of us would be forced to change our ways of teaching because, especially for introductory classes, I think students could get much more from a generative AI than they can get from a regular class. At least because they could engage with the generative AI, they could get tailored responses, they could get more examples. So this is something that would not be reasonable to achieve in a class of 100 students, for instance. Um, Now, what I have tried to do when it comes to AI was not to exclude it from teaching, but on the contrary, to familiarize students with it and also with its limitations. For example, both in China and in Romania, I was teaching qualitative research methods, and I gave students in the seminar one example of we chose a topic. And then I asked the AI to come up with an interview guide on that topic. And then we discussed critically the content. We regarded the positive aspects. Usually the interview guide looked very comprehensive in the sense that it had several dimensions of the problem addressed. But it was very superficial. It didn't have depth. It didn't have that much coherence. So instead of pretending that AI does not exist, I have tried to integrate it, and I have tried to support the students to engage with the AI in a way that would make it become more suitable to their needs. And this is one way in which I have tried to use the AI. Now, the problem is about one of the big problems is about assessment in the age of AI. And here I have to say that for 8 years I have used primarily essays for assessing the performance of my students. But recently I had to switch to exams delivered in person under supervision. So I think this is one of the limitations, but I'm also thinking that uh, many people are doing the same thing, and I think this could prevent students from developing their abilities of writing academically fluent and consistent papers. So I have many concerns about the AI, but I think we got to a point where it is impossible to ignore and impossible to pretend that it could be reverted.
Yeah, I totally agree because like for myself as well, I also have the concern, especially with the written assignment, student can just put it into the ChatGPT or Copilot, and then they can generate, let's say, maybe the whole assignment for you. And sometimes
Yeah.
I was just wondering, so how do I make sure that this is written by the students or by the AI? So as you say, maybe making it to be like presentations, or written exams, that would be better. But then at the same time, we might be thinking that, so how can we improve their writing skills, right? Because now we are assessing their presentation skill, but not their writing skills. How do they,
Exactly.
and how do we like support them? I think you have raised a very good point. To be honest, I don't have the answer as well. So maybe in the future, let's say one day, if you're able to identify how do we overcome this, please let me know as well. Okay. Yeah.
Sure.
So my next question is that, so what advice would you like to give to students or researcher who would like to work in your research area?
Well, I have only one advice. Never listen to other people's advices. I think this is the best advice I can give to students. I can say what worked for me. I have tried in my life to follow my interests and to have not very high ambitions, not raise the bar very high. And this helped me, achieve what I have achieved so far. For example, the research project on the emergency departments was something that I have been doing since 2012 until 2018. So for about 6 years, I have been focused on this topic. And I think nowadays, especially with the short period of funding for doctoral students, Many have the tendency to choose one topic and to focus on it for 2 years, 3 years, and then switch to something else. And there may be some advantages to this, but I think students are lacking depth if they are not pursuing a topic for many, many years.
I see. So my last question is that, so what research question or projects that you would like to explore in the future?
I became very interested in the topic of aging because it is, from a sociological point, very rewarding. It's about the changing identity of individuals. It's about the structural organization of this important period of lives. We all know that European societies are aging, so it's also a social problem that deserves more attention. And I'm very interested in understanding the moral careers of the older adults. So basically the trajectories that they have and the meaning making that is associated to them. I'm interested in understanding, for example, the common experiences of aging, but I'm also interested in looking at communities or groups of individuals who are defying these normative transitions. For example, older motorcyclists or people who are climbing mountains in the old age, people who are doing things that are not necessarily socially accepted for for individuals of that age. I'm also interested in how the transition into retirement is changing the way people think about themselves and the world. So this is something that I have become highly interested in the recent years, and I expect to do over the next 3-4 years.
Yes, I mean, like, just a very quick follow-up question. So I mean, like, so when you talk about like dementia and aging process, okay. So for example, like in Romania, so how do people see, let's say, maybe like the topic of dementia? Because in China, in Asian society, we see this as something like, okay, this is maybe something that's negative, or maybe something this is part of the normal process. So how about, in Romania?
Well, to be honest, I don't have a response because I did not conduct any studies and I haven't read any papers on dementia. I think it tends to be regarded also as something a little bit shameful or something that people are not naturally inclined to talk about. But this is just a guess. It's not, I don't have any strong empirical foundation for making this claim.
Okay, I see. Yeah. So any final tips or any suggestion or any advice that you want to give to our audience before we close today's session?
Yes, pursue your interests
Yeah,
and don't listen to advice from other people.
Okay. Yeah, thank you. So I'm just going
Thank
to
you
stop
very
the
much,
recording
Dr.
now.
Ma.